All right, what's going on, everybody? And in this video, we're going to talk about the different type of ultrasound machines that I have used in my clinical practice and really kind of the pros and cons of the two. So for starters, the very first ultrasound that I utilized was a handheld portable one that basically is the probe, and that probe has no screen. And so what you have to do then is you have to connect it to some sort of portable device. It can hook up to a phone, it can hook up to an iPad, a tablet, it doesn't matter. The good thing is with the vast majority of these handheld portable devices is that they are not particular on what device they connect to. Most of them can connect to the Apple ecosystem. Most of them can connect to the Android ecosystem. They're plentifully interchangeable. You can do whatever it is you want with them. I wanted something, I am in my practice and just my life, I predominantly use the Apple ecosystem, so I wanted something that could utilize both, and I was really pleasantly surprised and very happy to find that you were able to use them. So what I have here is just a demonstration of kind of the devices I would use. So right here, this is just an iPad. Actually, this is an upgraded iPad. So I have this iPad with a little pencil, which I rarely use for the diagnostic side at least. And so this would be something that I would take with patients. Again, full disclosure, this iPad is upgraded since then. The one I used was a little bit smaller. This is like the 12.9 inch. I think I used an 11 and change, 11.1 or something like that. So it was a little bit smaller, but you get the point. An iPad is an iPad is an iPad. So, and I also want to be clear that I've done it. I've utilized the ultrasound many times off of my own personal cell phone or work phone, and it was not a problem at all. So at least with me, with my young eyes, I was able to see everything I needed to see. Once you're done, you can actually take those images from one device screen to another if you prefer to just operate with something bigger. But again, that's the screen thing. Here is the device I use. So it is not nearly this big. I got this like Pelican device really because I just did not want it to get broken. I really was concerned that this expensive device was around $4,000 at the time that I purchased it. I think it was like $4,600 to be honest. I didn't want to break it, and I knew that I was doing predominantly mobile visits. I was predominantly doing visits in patients' homes at the time. It was kind of like the height of the pandemic. I did it before the pandemic, but after the pandemic, we went full-fledged, go to your home. And since the pandemic, at least in the state of California, lasted for a very long time, this thing saw a lot of life. And one thing I really liked is, although it only happened once, I did drop this case with the device in it, and I felt very comfortable that it was not going to get ruined. So for somebody who is traveling a lot, this is something you probably would want to consider, even just something that's like in your car. Now, of course, it does not need to be this big, not even close. And I'll go through why it's so big, but it has not only the actual probe in there, but all of the chargers, all of the extra batteries, the AC adapter if you run out of battery or you just want to plug it in. And so I do have it all right there. So it's just a one-stop shop. At a point, I could actually keep the iPad in here too. So it was really just a single isolated grab and go. I did not set it up to put any ultrasound gel in there, but you very well could have. There's room to do it. But again, here's the first device I used, and I used it a great number of times too. So over here, I'll go through and I'll make a separate video about what's in it. But basically down here, the first thing is, this is a linear probe, and so it's got this nice cover on it, which I'm a big fan of. And then it's just right here, this is your footprint. So like I said, it is a portable handheld unit. Modern day technology is allowing the units to get smaller and smaller, but I will say this, from as far as the design, really happy with the design of it, really happy with the functionality of utilizing this machine. Again, rip off the probe cover, put some gel, use it. When I'm done, wipe it all down, and just make sure I power it down because I did not want to run out of battery for the rest of the day with other patients. Not that I want to make this video about this, but one of the things I did like about it, and it is an idea to consider, is that this does have a removable battery. It's not a standard battery you can buy off the street. You can just call the manufacturer and they give you extras. Some of them have built-in batteries that cannot be removed. I have found it to be extremely convenient to be able to swap out some of the extra batteries that I have over here, as opposed to asking the patient, you know, hey, where can I plug this in? Again, it's not a complete killer, but when you do these things in the field, it is nice to have it. Super portable, super lightweight. And I also do want to be very clear, I did not need to take it like this. I could have very well just stuffed this in my bag. You know, if you have big scrub pockets, you could have stuffed it in the pocket. You know, everybody's different on what they do. I will say that this is overkill and definitely not recommended, whereas this is your footprint. Okay, actually, if you want to be completely transparent, this right here is the footprint. So you've got the gel, you've got the ultrasound, and you've got a screen. And it could be even a little bit smaller if you are utilizing a phone or just a smaller iPad or a tablet. So that is something that is definitely beneficial. So let me just put this back in for a sec. And now the one thing I will say about this is back before the dual-sided probes did exist. So this is a linear probe. I do not have a portable handheld curvilinear probe. And in my practice, I found that I don't use it too often. Even to this day with my upgraded machine, I do have a curvilinear probe, but again, I just don't use it as nearly as much as I anticipate. I do use it, so I don't want to, you know, negate that fact. But again, in my practice, I see a lot of shoulders, a lot of ankles, and a lot of knees, and the linear probe works just well with that. Again, an additional thing that's really nice with this is that it is designed. You know, this can go on a plane if you're doing any like extended travel. It goes well in your trunk. You don't have to worry about it getting banged up or anything like that. Again, this is nothing, I don't have it in case or anything to sell you. I just got this at actually Harbor Freight. I think it was like $11. So super easy, very rugged, way overkill, but it is what it is. The other thing I do want to emphasize is that, sorry to go back to it, is that this is, I think this thing is like cleared as a drop test for like 3 feet. You know, in the case of like, you know, you drop it, it says that, you know, you should be able to get at least 1 drop out of this, and it would clear. It would still function. I don't recommend it. I certainly don't recommend trying it out. There are manufacturer warranties, but if they see that it's neglect, they probably won't honor those. But the other thing is there is that little wrist strap on there. I would highly recommend using it. I have had a handful of times when things get slippery with the gel. You can lose a grip, and it is nice to have something that it's still attached to. Okay. Now, so the other one, I'm just going to get these out of the way. Now the other device I use, and this is my current modern day device, and so this right here is a laptop style. So what we have here is I have a laptop style. This is the Sonosite Edge 2, and so from here, I like this because this is also designed to be portable. It's also designed to be carried, and you can see that because it has a built-in handle. It actually has a built-in handle, and under here's the probe that comes out, and so the probe can come out and you can replace it with whatever probe you have. So a little bit of pros and cons. The image quality is far superior on this. That's just an absolute truth. The cost is far more than this cost. I recommend this as an introductory. Eventually, if you are using those handheld portable machines, I really do think anyone in their clinical practice, barring that your practice does grow, is you will eventually outlive the handheld portable unit, which is exactly what we had done. And trust me, it really is kind of a wonderful thing. The image quality will be better. A little bit of speed and efficiency, but one of the reasons I can make a separate video as to why I chose this device over other devices. But again, it is handheld. You can still carry it. It's quite portable. It's relatively lightweight. It's a little thicker than you would think it, kind of expect a modern day laptop to be. But one, I think this originally came out in 2014, and the predecessor model came out earlier than that. But this was actually designed for military use, so it is actually additionally sized and rugged for any sort of aggressive tactile or combat environment that they may be in. One of the other things is this is designed for in the field use, and so a lot of times they modernize it and say, oh, this is great to be used in a sports arena, but it was actually designed to get wet, and many times to be covered in blood or other fluids, and so this entire keyboard can get wet because has a rubber cover over the entire thing. You don't have to put anything special on it. When you clean it off, it's really nice because then you can just wipe the whole thing down, which is really good for just a medical practice in general. And again, I can go through a separate video as to why I chose this device over some of the other leading devices. I'm very happy with the choice we made. But again, I just wanted to show you that they're both small. Relatively speaking, they're both small. This one has its own built-in screen, pros and cons to each. This one also does have a removable battery, can be plugged in. But it does run on battery. I've gotten both of them. A full charge will get me around 2.5, 3 hours of continuous scan time. So unless you're just having a bunch of patients lined up, you should be able to survive a full practice day on one battery charge. But in the event that you're not, well, that means you're making money. That means you're utilizing this, and that's okay too. So you can probably afford to take an extra battery with you if that's the case. So, but here are the two devices. This is the current device we have. I don't have any intention of buying another device or upgrading devices because honestly, with the Sonosite has now upgraded their devices into the future where they're touch pads and they're kind of touchscreen, but they're actually using the same probe, and the probe is what is collecting that data, which means the image quality is not getting any better. They will probably try to sell you on that, and any other manufacturer besides Fujifilm, Sonosite, Philips, all of them, they're all going to do the exact same thing. But the thing is the probes haven't changed, and until the probes change, then you're absolutely going to get no better of an image quality. It just depends on how it is you'd like to use it. So those are the two separate devices. Both of them are portable. If your practice allows for you to, financially to just upgrade and jump right into this device, or kind of a laptop style device, I would strongly recommend it. I don't really recommend the big desktop devices unless you're just a thriving practice and you have $80,000 to kind of give away. This one will set you back anywhere from $20,000 to $30,000, and in doing so, it's still portable. So whether you're going from patient's home to home or clinic worksite to worksite, or maybe you just have multiple locations and you don't really know if it's worth it, and so you just take this from one site, from one of your brick and mortar locations to another, or maybe you're hybrid and you do a little bit of both. But again, if your practice does allow for it, I strongly recommend to go this route. If it does not, and maybe your budget doesn't, that's completely fine. Mine certainly didn't. If it doesn't, then go ahead and get the portable devices. It doesn't have to be the one I got. There's plenty of portable devices, much cheaper than when I got them, because after 7 years, things have gotten cheaper, and they should over time continuously get cheaper. And by doing so, let your business, let your practice grow into a sense that if you generate enough revenue, that let the revenue from the first cost acquisition, let that pay for the next one. And that would be the recommendation. That's exactly what I did with mine. That's what I would recommend for really anybody. Again, so it really just comes down to budget. You can absolutely get yourself a device under $5,000. A dual probe, two-headed probe for both linear and curvilinear. And if you don't know what any of those are, or if you're new to ultrasound, feel free to go ahead and check out our course. I have a course that we teach clinicians how to get involved and invested with ultrasound. We go through how to write up the templates, how to create a scan from start to finish for individuals that have some experience, little experience, and no experience. It is truly designed for beginners and designed for the clinicians to be the ones providing the ultrasound at point of care. So if you have any questions, drop us an email, link down below. Thank you so much.